Thank you for your invitation. This is my conflict of interest. My agenda, I want to talk in summary, brief overview of the International Diabetes Federation, mission, vision, and objective, the burden of diabetes worldwide and the MENA. Why is this increase in diabetes in MENA region? How is MENA IDF facing these challenges? And conclusion. As you know, the IDF short brief for the Global International Diabetes Federation. The IDF, a vibrant federation, it was founded in 1950. It includes 170 countries, 230 members, and we have 7 regions. MENA, it's one of the regions. Why IDF? Global community for people with diabetes, powerful voice. So the 3 main IDF mission: epidemiology, public health; education, prevention, access care and care; okay, thank you. So we have Atlas, a global burden, research, and we have School of Diabetes, education modules, guidelines, resources, prevention, research, etc. The right of every diabetic, every person should have the same access to the same quality of diabetes prevention and care. Every person with diabetes has the right to an early diagnosis, education, treatment, and prevention. I want that the International Diabetes Federation is in the pocket of every diabetes patient worldwide. Companies that need money because of people with diabetes should fund diabetes advocacy. So diabetes has many faces. The Global Diabetes Survey will powerful of this faces. Second item, the burden of diabetes worldwide in the MENA also. The figures that I will show come from the last IDF Atlas in 21. We developed the last Atlas in Bangkok next month. So number of people with diabetes worldwide per IDF region in 2021 and 23 and 2024. So as you know, in 2021 we have 537 million, in 23 and 30, 643 million, expected to be reached 784 million in 2045. In the MENA region, the higher percentage, it's increased by 87%. Unfortunately, we have 3 times more in 20 years. In MENA region in 2000, we have 55 million, now 73 million. In 2023, maybe 150 million. So in 2021, IDF Atlas estimate 1 in 10 adults between 20 and 79 years has diabetes, 537 million. 1 in 18 adults between 26 and 79 years has impaired fasting glucose. 1 in 6 die. 3 in 4 people with diabetes live in low and middle income countries. 9% of 11.5% health expenditure spent on diabetes. We have 6 million, 1.7 deaths related to diabetes. So 100 67 million adults with empathic record. We have 7,000 more pregnancy attached by hyperglycemia. And 1 in 2 people with diabetes know they have it, and 1 in 7 births is affected by gestational diabetes. 1 in 12 people today has diabetes. So every 12 minutes stroke, 19 minutes myocardial infarction, 90 minutes in amputation, 60 minutes in new cases of dialysis, 90 minutes in new case of blindness. So we have 5.1 million deaths per year. What is diabetes in the Middle East and North Africa? As you know, the MENA region has 22 countries, 31 associations. The founder of IDF MENA, the 3 Musketeers, one from Egypt, Professor Mursi Arab, one from Pakistan, Professor Samad Shera, and from Sudan, Professor Dawa. So diabetes burden in MENA, adult population aged between 20 and 79 years in 2025, 448 million. In 2030, 540 million, expected to be 703 million. Diabetes MENA prevalence, 6.2% now. In 2030, 19.6%. In 2045, 20.4%. Number of people with diabetes, now we have 73 million. 73 million. In 2030, 95 million. In 2045, 136. Number of diabetes due to deaths due to diabetes, 8,000 per year. So this slide, this is this list, top 10 for diabetes in the world prevalence. As you know, Pakistan number 3, Egypt number 10. So we have 2 countries in our MENA in the top 10 list. So 1 in 3 people living with diabetes in the region are undiagnosed. Diabetes is responsible for 796 deaths in 2021. And so the prevalence of diabetes mellitus in our region is very high. The highest prevalence among the 7 IDF regions now. Unfortunately, it will remain higher by 2045. So it is catastrophic. Now, in 2019, diabetes-related health expenditure in the MENA, 25 billion, expected to increase by 2030 to 33 billion, and by 45 to 39 billion. So diabetes prevalence percentage in adult between 20 to 70 years in prevalence, Yemen is the lowest, Pakistan the highest. So top 10 country prevalence, Pakistan, Kuwait, Egypt, Saudi Arabia, and Sudan. So PWD and countries affected by disaster by million. As you know, Iraq, Syria, Afghanistan, Yemen, Palestine, Libya, Lebanon, Pakistan, Iran. So this is a region of most disaster of all the 7 regions. 1/3 of the population of the MENA region are living and having disaster. So one of the important challenges we faced in MENA, delivering insulin to young people in Gaza, in Lebanon. About the metabolic syndrome, the MENA region is now known for its high prevalence of metabolic syndrome, remain from 17% to 49%. So MENA region, the tsunami diabetes area, 450 million adults, 73 million patients with diabetes, 150 million diagnosed, undiagnosed, and pre-diabetes, and 49 million PWD affected by disaster, 17 million short of insulin, expected grow 87%, cost $33 billion. So why is this increase in diabetes in MENA region? So because 80% of diabetics type 2 are obese in the MENA. Obesity, the neurocensory epidemic. What are the root cause of obesity in our region? The misconceptions. Obesity, a symbol of affluence. The revolutions that have changed human life, like agriculture revolution, Gulf countries, the discovery of oil, changing lifestyle, diet and physical activity, the prevalence in modern society of many chronic disease is the consequence of a mismatch between our modern diet and lifestyle and our Paleolithical genome. So the main risk factors in our region, discovery of oil, a lifestyle change. So also, the smoking, it's very high in our society, in MENA region, in the West circumference also. 80% of people with diabetes in our region live in low and middle income countries, except Gulf. How is MENA IDF facing the challenge? We need to stop diabetes. What we have to do to improve the life of PWD, stop or slow down this evolution in our region. So diabetes is changing the world. How can we change diabetes? By prevention, early detection, and effective treatment can make a difference by eat healthy, exercise, and treatment. 30-minute minimum or each day can reduce the risk of developing type 2 diabetes by up to 40%. So people with diabetes deserve a better life. So we need understanding patient need. 3 out of 4 people with diabetes suffer from the impact of the disease on their mental health. So this year, the World Diabetes Day theme of the year, diabetes and well-being. So recent studies on people with diabetes have shown that 36% of people with diabetes suffer from psychological stress due to diabetes. 63% of people with diabetes are worried about the impact of diabetes complication on their health. 28% of diabetics find it difficult to be positive about the situation. So from theory to practice, you need to implement the UN resolution issued in 2007 by the General Assembly. The main objective of the UN resolution, increase investment, expenditure resources in diabetes care, improve access to better diabetes care, promote more effective education for healthcare providers, lower the rate of increase of diabetes prevalence, create a national diabetes program in each country. So the way to a national diabetes program, obligation of different party, minimal requirement, and national diabetes registry, etc. Governance, contribute to the improvement of the governance of each association. We execute turning MENA country and all MENA members guidance workshop in Syria, Kuwait, Qatar, Yemen, Lebanon, Jordan, Iran, Sudan, etc. Sharing experience between MENA association and our region. We have many agreement collaboration between the association. So encourage national diabetes plan and program. Priority objective in MENA region, reduce diabetes prevalence, better access to quality care, and the prevention of complication prevention, health promotion, education, screening, early detection, and intervention research. So we have many screening awareness campaign in all member of the region, the MENA. This is an example about the screening and development of material in two languages, English and Arabic. Recently, we launched a book about diabetes and pregnancy in Amman, in Bahrain, in Arabic, in Pakistan, in English. So training, many training about diabetic food, diabetes in Ramadan, etc. Access to care, it's very important in case of disaster. So quality of care, diabetes education is very important. IDF, young leader in diabetes in camp. Now, what is the barrier preventing access to diabetes care? Insufficient resource and insufficient system to ensure access to essential medication and diagnostic, an effective system to ensure uninterrupted supply of insulin and supplies to those who need them. 50% of people with type 2 diabetes who need insulin do not have access to it, etc. So in conclusion, we are facing now many challenges in our region. The prevalence increasing of diabetes, high rates of complication, unhealthy lifestyle modification, expenditure of diabetes treatment are very low in some countries, lack of education and awareness, disaster, and the MENA plan these with problem need to work together. Thank you for your attention.